we have seen in different lessons that the setup for a lower cervical adjustment between C3 and C7 is identical for all techniques. So all the techniques between C3 and C7, hands-on techniques, have the same setup. Now they use in that setup a thrust which, generally speaking, is given from posterior to anterior. Now, if we treat posterior anterior on one side of that vertebrae, using the same vertebrae, we could go on the opposite side of that vertebrae with the same setup and give a thrust antero-posterior. Now, most of the time, you will not observe an audible release with that approach. But we are not looking for an audible release. We are looking for a positive clinical result, the patient feeling better. So this is quite useful in certain type of spondylolisthesis, or certain patient basically will respond much better to that than anything else. So let's look how easy it is to proceed with an anterior contact versus a posterior contact. So you're going to, the example for the neck on the right side, you're going to set up your technique like you would do if you were going to treat the patient on the right side. You're going to go lateral bending on the right and rotation on the left. But then you're not going to use that contact on the right. You're going to go on the opposite side and instead to go posterior anterior on that side, you're going to go antero-posterior on the opposite side. And by the way, for that you can use a drop or you can use a little clicker if you're not comfortable with the drop, and it works beautifully on specific patients. When the indication is there, the indication will come with another video.